Hi, I'm Dr. David Hill, and today we're going to be talking about how to ease the symptoms of a stomach virus. Now, stomach virus is a term that really covers a lot of different infections that infect not only the stomach, but often the entire intestinal tract. Usually, you know you have a stomach virus because of fever, diarrhea, vomiting, some abdominal discomfort. You should not, however, be having blood in your stool. That would not be a sign of a stomach virus. Vomiting up blood is not a sign of a viral infection. Severe abdominal pain, if you have a fever over 104 degrees, those are all things that would make you think you've got something more serious going on and need immediate care. However, if you have the usual stomach bugs, sort of a short-lived 24-hour set of vomiting and diarrhea and some discomfort, then you really want to try and get you or your child through this as easily as possible. The most important thing is to not become dehydrated. Obviously, you're having a hard time drinking. You're having a hard time holding down fluid. You're losing fluid through vomiting and certainly through diarrhea. But remember, it's important to keep putting that fluid back in. Even if you're vomiting frequently, you don't vomit all of the fluid that's in your stomach. You do keep some. So taking small, frequent sips of fluid is very helpful, even if you are intermittently vomiting. For young children, the best fluids to use are specially created fluids that include a balanced solution of salt and sugar. Some examples are Pedialyte, K-electrolyte, anything pretty much that ends in light you can count on being that sort of fluid. The sugar and the salt help bring fluid into the body from the intestines, and that's why that's so helpful. If diarrhea is a major component to the illness, you want to avoid fluids that could make it work, especially fruit juices, sugared fluids, things that have a lot of sugar like soda. Even Gatorade can have too much sugar. Often, when you're having a diarrheal illness, the body's ability to digest milk will be temporarily reduced. So milk may make the diarrheal symptoms worse for a few days, and you probably want to avoid milk. On the other hand, breastfeeding babies should absolutely continue to nurse through the diarrhea. This is precious fluid, and it might even make things better. Now, for people who are having a lot of diarrhea, also lactobacillus, which is an over-the-counter supplement, the good bacteria that help your intestines function. This may shorten the course of your illness. However, the key is, if you're not getting better after a couple of days, or if you have a young child who isn't getting better after one day, seek care. If urine output is decreased, there's no pee in an 8-hour period, you may need more aggressive rehydration done by IV fluids or even in the hospital. So be sure and seek care for that. But if you got one of the usual bugs, remember, keep drinking and take it easy till you get better. Talking about easing the symptoms of a stomach virus, I'm Dr. David Hill.